Good day, everyone. Thanks for joining. We're going to wait just a few more seconds before we get started. Okay, good day again. Hi, I'm Jeff Fuller with Divergent. I'm going to do introductions here and get this webinar started. Want to welcome you to this event and thank you very much for spending part of your valuable day with us. Before introductions, I'd like to go over a few pointers to help you get the most out of this webinar experience. And first, we encourage you to ask questions at any time during the presentation. There is a Q&A button at the top of the screen. Please use that. We'll try to get to every question asked, but if we run out of time, Christina or I will follow up with you offline. And second, I'd like to ask you to let us know how you're feeling and where you're at on these topics as we go through the discussion. There's an emoji reaction button you can hit at any time, and we also will be posting some poll questions throughout the discussion and would appreciate your participation in that. Finally, if there's something you missed or want to follow up on, you'll receive these slides and a recording after the webinar. And within that is contact information for both Christina and I, so we can engage and continue this important discussion going forward. And so with that, I'm excited to get started on the program. So we'll start with introductions. I'll go first. I'm Jeff Fuller. I'm the Vice President of Analytics Delivery at Divergent. My background is in health system and health strategy operations, transformational activities around new care pathways and value-based care. Spent the better part of the last 15 years in a data and analytics role with 3 different major academic health systems, and have recently joined Divergent to lead our advisory services practice for data and analytics maturity. So thank you for joining us, and I'll pass it to Christina for her introduction.
Thanks, Jeff. I'm Christina Grimes, and I am the digital health strategist for EMRAM, which is our electronic medical record adoption model with HIMSS. I am a nurse by trade and worked everywhere from the NICU to the adult CVICU and multiple states and cities across the country. And then I moved into the healthcare IT world about 11 years ago. And as the EMRAM model continues to evolve and have a much higher clinical focus, and we're really looking at things like patient engagement and clinical outcomes, it made perfect sense to bring in a nurse who likes data and analytics and healthcare IT to lead the new face of EMRAM going forward. So we're really excited to be here and share with you how EMRAM can positively affect your organization.
Great. Thanks, Christina. Okay, so our agenda for today, we're connecting 2 topics that are definitely near and dear to Christina and I's heart in the work that we do, but it's not one that's often connected, and that's the relationship between connecting good data to value for patients through the EMR. And so this roadmap here is just to talk about the fact that as much as technology and data can come together to make value for patients a reality, it's really all about the people, the organizational traits, the culture, and the change management and adoption that's needed in order to be successful. So we're going to spend the first half talking about the role of data and analytics in a typical health system environment, and the importance of good data and repeatable, reliable data in order to achieve value. And it all starts with the EMR. And so we are very much interested in making some connections for you all in your organizations on how to connect the workflow and what's in front of end users from a data and decision support perspective through a mature EMR configuration to really making change happen and strategically managing performance. And so with that, let's start with a little bit of my take on a current state for health data and analytics as I see it. There's a lot of words here that are probably relatable to most of you, but I'll just take a minute to highlight that this landscape of ways to improve how we make decisions is really underwritten by this common idea of how do we address rapidly changing opportunities for improvement in healthcare. When we were thinking about gathering insights to make care better, we often are left thinking about responding incrementally to change. There's data barriers that prevents us from thinking about enterprise strategy from a patient perspective, and the workflow is often playing catch up to really aligning this with an opportunity to make better improvements. So there's data work is a labor intensive process. It's not often an interesting strategic stakeholder strategy at the organization level, but it is required for success. We really can't reasonably address the advanced and quickly evolving landscape when you hear about AI and all the latest buzz for advanced analytics. Without that common ground for culture change, behavior, adoption, and data reusability, it's not going to be successful. And that really all starts with how we configure what's going on in the workflow, which is why the EMRAM and the adoption of the EMR is so critical to addressing some of these challenges. So before we get started, let's launch a quick poll question for you all that are here. For what you know about the EMRAM process, which is a 7-stage, actually 8-stage maturity model, where do you think your organization would score if you were to take it today? Take a minute to respond to that poll question. Okay, looks like we've got
5.
F5, yes, middle of the road. So what you're looking at here is an analytics maturity basic picture that really is important for setting the stage for how do we develop meaningful analytics. It requires us to first focus on effective data collection and appreciation of the operational context that is in place when we're trying to make an improvement. So we have to be able to describe what happened and count what happened, be able to diagnose problems through operational review. This happens through process measurement, through establishing good strategic performance management at the front line when data is being entered and is being accumulated and aggregated into performance measures. And this is all part of the EMR adoption. The perspectives from the end users that you want to try to keep an eye out for when you're thinking about analytics maturity as it relates to EMR adoption, I often think about, if you've got stakeholders that are looking to produce a dashboard, say in the EMR itself, you definitely want to make sure that it aligns from a data perspective with what's happening outside the EMR. And so if you've got folks that are looking at dashboards within an EMR and this says, well, this shows a different result than what we see on this report we get in a different mechanism, that's a red flag. Or if you have a business unit, organizational unit, or clinical unit that says, well, we use a different definition for that metric. That's something that needs to be addressed. Or the workflow is different in different areas of the organization. And so if we want to get to predictive and prescriptive from a data perspective, you have to have that underlying context and content. This is a people and a collaboration activity. The data will follow. And there's a lot of work that I've done in the past several months with organizations that really come to us with that problem that we want to have data governance, or we want to have a more strategically aligned analytics capability with better insights. And it always comes back to, well, who are the people that are going to be involved in creating that value for your organization. And when it's done well, here's an example for a patient access strategy. So if we've got the ability to count within the capture of data in the EMR, what was it that happened from an appointments perspective, what were the attributes that aligned with things that might be interesting to pull out from there? So like, is it one practice or one specialty, or is it factored by day of the week, or even things in context of like new clinics opening or changes in provider staffing? All those things rely on a master data metadata strategy that is built into your data collection process, which is the EMR, so that you can then factor in better prescriptive and predictive analytics going forward. If you're trying to reduce no-shows, for instance, then you want to be able to predict the propensity of a patient to no-show. That can be done without those data foundations in place. And again, that operational context is so key, and why it's so important to really focus on EMR adoption and change management. I've been doing this a while in different organizations, and it took me a while to get to this point in my thinking. But when I finally had that aha moment of thinking about developing analytic solutions with a product mindset, that's when things really started to make a big impact for the organizations I was working for. The main difference in this approach is to think of analytics not as a support function where there's just requests coming in a queue that you need to respond to with some sort of action or a dashboard or report or metric creation, and that it's really designed to build capabilities based on the problems we're solving. And that really has to come together with good people that are at the table to collaborate and think outside the box, and empowerment of the roles on the team from a technical, the data and IT perspective, and the clinical stakeholders and the end users perspective, that they are empowered to engage in developing problems in a way that is going to create better solutions in the end. So this type of thinking results in ultimately more efficient results, more effective products, and establishing these roles in this type of operating model can highlight the interconnected relationships in the processes and workflows that will drive better value for patients that are often unexpected or not necessarily easily understood until you go through this type of approach. And I think it's important that again, that you have to be respectful of how things have worked in the past, and appreciate current state before you can define an ideal future state. And what the result is it can be a complex tapestry of needs and problems to solve. This is just an example of how solutions can be unified for robust with a robust problem framing approach. This type of output, you can see that it's just a sampling of all the different things that goes into the ultimate goal of transforming care and integrating clinical practice. And so if your organization, for instance, has a value-based care operation, a lot of these things are what you would be pulling out from these collaborative sessions of a product approach to solve these problems. In a lot of ways, this is coming together to provide patient benefit, and that can be lost when it's more of a demand-driven support ticket type of approach. You often can lose sight of what's important and what matters to the patient. And so taking simple approaches to framing the problem with a product mindset can help uncover better opportunities exponentially to improve that patient experience. And this is a quote from HIMSS that I really liked, but it's one that I wanted to highlight here because we've talked a bit about how important it is for people to come together and collaborate. And I think it importantly draws to mind the culture of how to improve care, and that it's often thought of as a competency that you have to hire for or have technology for, but at the end of the day, it's really a set of skills, and it needs to be part of the culture, ingrained in alignment with the strategy for your organization, and that you need senior leader engagement and support in order to really get there effectively. And so connecting to the mission of better care for all requires that every aspect of the organization is thinking strategically, not reactive. And when I think about developing data and analytics, I think about this iterative cycle of an analytical solution, where you're certainly defining problems, opportunities, and all that stuff, and getting the data in place so that it can be effective. But this type of cycle is really important to show that each aspect of it can get back to the daily workflow. How can we operationalize the results is a very important question to ask. And so that has to be in mind when you set out at the very beginning of investing in your time and resources in good data and good analytics. And so that's certainly a connection to EMR adoption and optimization. But with that end in mind, you start to come together towards a better sense of what creates value and what is going to be meaningful ultimately to improving your strategy. And we all are familiar with organizations that we've worked in or have worked in where there's literally thousands of dashboards that are available to inform you about how to make better decisions that can contain tens of thousands of measures. So where do you look for the truth, and where do you look for intelligence to be able to really make a difference? And how do you learn from it in order to take action to improve your situation? These operational norms that exist where dashboard, the request to your data analytics team might be, I need a dashboard. And the response is trying to prioritize what really is the need for yet another dashboard. I think it's really important to think about adoption of decision support, decision at the front line as a collaborative relationship between minimizing the silos, the barriers of organizational functions, and that comes with standardizing information. And then the enterprise analytics function is to take those data and make them reusable from the perspective of creating better insights. And it's not until you recognize that those are really two sides of the same coin that you can exponentially improve the value of your data investment. And of course, with that, data governance is a big piece of it. And without data governance, you can't really take advantage of the exciting new endeavors to keep up with what's possible with better data collection. So as we break down the silos, we're also breaking down and participating in the breakdown of the traditional four walls of the health system in order to get creative about how individuals live their lives and their behaviors towards their health, and how we can collect more and more data beyond just the clinical transaction itself to do more innovative modeling of improved outcomes and value. And so I think of it in terms of the idea of a learning health system. Traditionally, you think of a learning health system as one that is academic in nature, relies on evidence-based medicine in order to establish best practice clinical pathways and refine those protocols based on what's learned from that. But the new opportunity with being flooded with all sorts of data and the speed to value with collecting that data and reusing it is that we're transitioning to medicine-based evidence. So it's just that if we can inform those scientific evidence with what a patient feels about their daily lives, or how their social situation is, or the environment that they live in, or the different factors that goes into engagement and adoption of better health for all, then we can really measure new things in different ways. So this readmission risk example here is one that I think about a lot. We all rely on the EHR to collect thresholds measurement of data for patients that might be at risk for readmission. That happens in real time when you're in the acute care bed. And it's very important, and it's been proven to be effective in identifying patients at risk for readmission. But there's an opportunity with better data governance and better collaborative change management to incorporate different factors about the patient's situation in real time in order to enhance that experience. So, are they going to be able to get to their follow-up appointment? Do we have issues filling the prescriptions? Do you feel safe at home once you're discharged? These are all factors that are not part of the traditional measurement of readmission measurement, but with an EMR that can be flexible and has standard ways to incorporate new sorts of data into the workflow, then we can get really interesting and innovative approaches to reusing that data for better decision making. So speaking of data governance, I'm going to pause here and just ask you to participate in this other poll question about data governance, and ask you, what is your organization's level of adoption for data governance? Do you feel that it is hardwired and part of your organizational strategy? Or is your organization proficient in data governance? Is it non-existent? Or do you really need help in understanding what data governance is? I'll pause for just a second. Okay, looks like we're all pretty proficient. And that's good. That's good. And I guess maybe the difference between proficient and hardwired could be some of the points that are here, which is data really is a common denominator for new innovative care. It is quickly becoming an opportunity to think about how to creatively serve our patients. Things as simple as like price transparency that breaks down the relationship between payers and providers, or understanding that data as a strategic asset can really help us come together and define more broadly a better experience for health value for our patients and consumers. And data governance is not a difficult endeavor. It often is something that is avoided because it feels like it's going to be a big lift. But my argument is it can be just as simple as how do we get to the goal of the data through a better treasure map. And so the principles I often highlight are that it's got to be practical. It's got to be proportional to the investment of time that we give to this endeavor, that it's not something that is a project. It is something that just is incorporated in our daily lives and working to improve health. And it's not just a tool, so you don't have to go out and purchase some expensive thing. There are simple things that can be done in order to get to that point where like I said before, the context and the content of the data from an operational workflow perspective, if it can be looked at as an asset, then you're going to have better frontline decision making. You're going to be able to generate more performance, better value by taking advantage of the fact that collecting data at the point of care and doing that in a way that can be reused for better insights on where to improve value is a first couple of steps that can be done fairly easily without having to hire more people or purchase new technologies. And we certainly have been able to see that time and time again with organizations I've worked with that have been more on the bottom end of that poll question, which is not really sure what data governance even is. And so I wanted to just highlight another important aspect of EMR adoption and better data, and that is that the change management and the culture of collaboration really matters the most when we're engaging clinicians in the process of care redesign. There's a lot of great thought leadership about how to do this. This is Dr. Brent James, who is with Intermountain Healthcare and at the time of this publication. But this idea that managed care means managing the process of care, not managing the physicians and nurses, is derived from Edward Deming philosophy on how to improve the complex environment of health delivery. So in other words, we need to engage clinicians in the process of care redesign because they understand the care delivery process and they're better equipped they're best equipped to figure out how to improve value. And for this reason, I strongly believe that their involvement in the EMR optimization and changes is critically important. And it's the mentality of you can't get good reusable data to make strategic improvements without an empathy for the process in the front line. And so this is a good transition for my colleague Christina to talk about the nuts and bolts of the EMRAM adoption model. And so Christina, I'll hand it over to you.
Absolutely. Thanks, Jeff. So this brings us to some of our favorite topics, which is the electronic medical record. Some folks really love it, and some folks might need a little more convincing on why it's just a really great tool for your clinicians. So over the last several years, we've seen that the EMRs have really undergone a rapid evolution and how they interact with clinicians. And this is really based on clinician feedback and the needs of your frontline workers and what will make their jobs a little bit easier and more effective. The EMR is expected to be more than just a documentation system and a data keeper. Our frontline workers being able to really voice their opinions and having their ability to influence what the EMR looks like for them. It has become a tool that clinicians can lever to surface that right data at the right time so they can make an informed decision about the right type of care. And this is resulting in improved clinical outcomes and then also just clinical user satisfaction. We see that nurses tend to leave this field. And one of the reasons that they say that they're actually leaving healthcare is because the EHR is working against them. And so we encourage organizations to listen to your clinicians and don't manage how the nurse and the physician work, but include how they work in the processes that you're building into your EHR. And so a little bit about the EMRAM maturity model and what it is. We developed the first one in 2005, and that was the first of our digital health maturity models. And we have an entire suite of different maturity models that you're more than welcome to look into. But EMRAM was our flagship one. And it really focused on how we can support health systems, making that initial transition from being a very paper-dominant organization to that aspirational paperless environment, which is much more attainable today than it was in 2005. And since the creation of EMRAM and the additional maturity models in our portfolio, over 2,800 institutions worldwide have achieved the highest level of EMRAM scoring at a 6 or 7. And then the populations that are estimated to be impacted by the HIMSS maturity model is 830 million across the globe. So we really are seeing this on an international level that organizations are looking at how can we look at our data, how can we look at our EHR experience, our infrastructure, and how can we compare that to global standards so we are delivering the best type of care we can to our patients, and we are ensuring that our clinical users are experiencing high levels of satisfaction. So coming into what the model actually is looking at, what is EMRAM? It's really just a tool to measure the impact of your EMR. It's not going to tell you it's good or bad. It's going to just simply give you a measurement of where do you stand against, where your current capabilities stand against the international market. How can you measure and create that benchmark to grow against? And then it's just a third-party independent attestation of where you are today and giving you a roadmap of where you might want to go tomorrow. So the model is updated every 3 years to give your organization a continued opportunity to reassess where you are today against that global standard. And what we're seeing is organizations who do engage with the EMRAM model and leverage the insights that it can provide are reporting improved patient safety, improved clinical outcomes, increases in operational efficiencies, and are experiencing financial returns. Now on this slide, there's a really great number up there, 60 million. Just keep that kind of in your back of your mind because it will resurface again and we'll dive deeper into that really incredible number here in a couple minutes. So the EMRAM requirements. A lot of people ask, how do you create a tool? What is in the EMRAM? Well, we really focus on 5 areas. And within those 5 areas, we're looking at your data capture and your health information exchange. If you are experienced with EMRAM, you'll know that that's a big cornerstone of how we've always operated was what type of data is being captured and how is it talking to other organizations. What we've really leveraged now is patient engagement. That's that next focus area. That is new to the most recent modernization of EMRAM is how are you leveraging your patients? How are you encouraging them to be a part of their own health experience and wellness? And then we start looking at things like analytics and outcomes measurement. You've collected the data in the EHR. So what are you doing with that data? And how are you showing that the data you're collecting is responsibly moving forward to enhance the care that you're going to be delivering? And then, of course, the core pieces of resilience management, ensuring that it's going to be up and running and that your clinicians have protocols in place, to be able to pivot in the event that something does occur to your electronic world. But we would like to see that, it's up and running at consistent times. And then clinical user adoption. This really measures not only how effective is your EHR, but how are your clinicians on the front line enjoying their experience within that EHR, and are they truly adopting the technology that you've made the investment in? So moving forward, what is the footprint? A little bit of a bragging slide here. But the interactions with the EMRAM model continue to be the guiding resource for many organizations across North America. We do have a global footprint, but for this purpose, we decided to really focus in on what does the North American landscape look like over the past 3 years. So our validations are good for a 3-year period. So we have only done the last 3 years as of June 30th. And I can tell you already this footprint and this map is out of date. So since we have published it, we've already welcomed several new health systems into our stage 6 and stage 7 achievement levels. So we're really excited that it continues to evolve. But as of this printing, we had scored 88 of the facilities were achieving a level 7, which is the highest level that you can score on our digital maturity model. So we were really excited and really proud that we've got such a great footprint here in North America, and our facilities are really engaged with ensuring that the EHRs that we're deploying are very clinically sound and are meeting those global standards and very competitive. So just kind of moving forward to an actual real world example. So that $60 million number that I mentioned earlier. So we'll dive into how Yale New Haven is realizing 60 million a year in savings. So not just a one-time great number of achievement, but a year-over-year return on optimizing their EHR and the operational improvements that they have seen by doing that. So they engaged with our survey, and then we provided them the metrics using what's called an achievement assessment report. And it really breaks down those 5 focus areas that we looked at earlier. And within those areas, they're able to see where there could be a potential gap or an opportunity for improvement. And working with our partners as well as the HIMSS advisors, our partners like Divergent, for instance, we actually help come in and work with organizations to create a roadmap or a plan to improve any of those focus areas that they feel that they'd like to allocate more resources towards. And what we saw with Yale New Haven is by focusing their efforts and resources, they were really able to reduce cost across several of their departments. And one that I really like to focus on is those medicine long stay patients. They were able to reduce the number of avoidable days by over 1,500. And what they did was leverage indicators in the EMR, the data that was already being collected, and then using smart alerts. They were able to guide clinicians to better identify those patients and transfer them to the right level of care sooner, whether that was a offsite location like an LTAC or a continued nursing facility, or discharge straight to home. But by doing that, they realized significant savings in that area. And not to mention patient satisfaction. Everybody would rather be home than in the hospital. So by getting those patients home earlier, their patients were reporting higher satisfaction rates. And then I love this quote from Dr. Show that is on the screen here. And it really kind of circles back to our comment about the EMR being a tool in the doctor's bag that helps surface that data to make those informed decisions. It becomes invaluable at that point. Just like an elevator, you can't measure the ROI of an elevator until you've had to walk up those stairs over and over again. Once you have that data that's right there at your fingertips, and it's so easy to surface, and it's supporting the knowledge that you got medical school, so you know that you're making the best decision for your patient, the EMR becomes as invaluable as a stethoscope in your bag, as the elevator is to get up to the 9th floor. And so we really see that this is a tool for operational leaders too, not just clinical leaders, but operational leaders to go in and dissect the data across your unique units, your patient types, the procedures, and identify opportunities to become much more efficient, reduce wasteful practices, and encourage better clinical outcomes. And on this next slide, we'll actually dive a little deeper into all of the ways that Yale New Haven, just from seeing that achievement assessment report and creating a roadmap to bridge some of the gaps that they identified and opportunities for improvement, you can see across multiple areas, they found little ways that they could come in and make adjustments to the current state of their EMR and use use the EMRAM as almost a guiding star to configure the future versions of their EHR to really work for their clinicians, not against their clinicians, and to support their operational goals. Now, this next example from WellSpan is one that really, as a nurse, it kind of speaks right to my heart. I think this is a great way to show that an organization reviewed their current processes, understood where maybe there was an opportunity for improvement, built in those new processes into the EMR by using clinical staff input. And then the adjustment literally saved lives on here. We can see 200 individuals over the course of this study, their lives were impacted positively. Because the organization recognized, Dr. Jeffrey, who has a quote up here, recognized that there was a standard alert inside their EHR for sepsis. It's in a lot of different EHRs today. There's clinical decision support around it, and it's a wonderful tool. But the way that the tool was being released in the EHR was actually causing alarm fatigue. It was continually alerting the frontline staff, even when the patient did not need to have that alert attached to them. And so what that was causing was sometimes the alarm to be ignored altogether. And that's not the type of care we want to have for our patients. So the team came in, they reviewed the alert, they developed a plan to effectively reduce the sepsis mortality around that alerting system. And then they reconfigured how the alert was managed and redirected it. Instead of every frontline staff getting an alert constantly throughout a shift, for a patient who may or may not truly qualify for sepsis, it went to a central team. And through that redirection, that dedicated team was able to improve their compliance. They were able to reduce the initial screen time, and they ensured that the right clinician was alerted and the sepsis protocols activated for the right patient. Instead of a blanket alert, it was a very targeted alert. And I mentioned earlier, it resulted in 200 people being saved over the course of the study. And so it's just a really great example of how you can look at what comes in your EHR. A lot of our vendors are really great about putting amazing attributes inside of it, but adjusting them to your patient population, to what your clinicians are saying, what your nurses on the front line and your doctors are saying, and then adjusting and pivoting to ensure that the great tools that are built into the EHR are being used effectively and appropriately. And so kind of pivoting to on when we're really looking at the EMR, it is really only one piece of your full digital health transformation. It's a very crucial piece, but it's only one piece. And the way HIMSS really looks at organizations and scoring them across several metrics in our different models is to come up to this digital health world. And we really want to show that what is the journey? And all of the models give you a great score in their particular areas, whether that's analytics or it is digital imaging or your EHR or your infrastructure. But looking at it from a 30,000 view or the 10,000 view, the digital health indicator is what we use to holistically measure the progress of your organization to a full digital health ecosystem, with 4 focus areas being governance and workforce, predictive analytics, interoperability, and that person-enabled health. We use this tool to really measure the strengths of your data, the evidence that you're collected in the real world, and the outcomes to provide feedback on where you are today and how we can get you into that highest level of the digital health ecosystem. The building blocks. And we do have this as a pyramid, but each one of these have equal weight if we really look into it. So diving a little deeper into what those 4 areas are in the digital health ecosystem is exploring that very comprehensive look at what is your infrastructure like? What is your data stewardship? We look at things like, what are you encouraging your employees when you talk about cyber hygiene? So you can ensure that the data that you have collected is safe and secure. And then how does that data that you've collected translate from your organization to the patient's full care continuum? We do know that our patients live 99% of their lives outside of the four walls of a hospital. So how is the data you're collecting when they're inside your organization translating to their care in the community, to their care at home? How are you absorbing the care that they are receiving at home from something maybe like a wearable, and incorporating that information into your continued care plan so that you are treating the patient as a whole person and not just as an episode. And then the data that you are collecting, so it's not transactional, it's transformational. How are you using that to influence the care delivery across your organization? How is that being brought in so you can learn from it and share knowledge about it, and then potentially influence how future clinical outcomes are delivered? And lastly, the patient. We really want to see that the patient is empowered to be a part of their own health. And then how your organization is actively helping that patient manage their health. You're predicting risk about that patient. We mentioned that earlier, readmission risk. It's one thing to collect certain data, and it's another to use that data to ask those powerful questions. And ensure that the patient who might be really excited when they're going home actually knows that they're going to be able to fill their prescriptions and that you've predicted and help them overcome that potential obstacle. So we're really looking at patient engagement, and all of this goes into our overall goal. It's your organization's goal. It's our goal here together, is population health and wellness. Healthy populations are much more productive populations. And so we want to ensure that health is accessible and equitable for all, and that our organizations are leveraging data to really help empower our populations to be the healthiest they can be. And so kind of to wrap that up, it's really just reaching back to the HIMSS mission, which is to reform the global health ecosystem through the power of information and technology, coupled with our digital health transformation partner, Divergent, whose mission is to be your partner in digital acceleration. We're really excited to have teamed up so we can present a really great tools and guidance, so your organization can take this back and optimize your data and see how your EHR experience lands today and can be enhanced for tomorrow. And so I will turn this over for our Q&A session and for Jeff and I to open up the floor for everyone if you've got any questions or some topics you'd like to discuss more.
Great. Thank you, Christina. So our contact information is here, just in case there's an opportunity to engage after this. We would love to continue the conversation. But you definitely have a chance now to put questions in the Q&A box. And so our first question is a really good one. So who is the stakeholder that needs to be the most bought in to achieving EMR maturity and data maturity? And so I think that's a really good question. So I'll start just by saying it goes back to what I was saying earlier, which is there's a balance that has to be met between centralized, highly centralized versus decentralized empowerment for making change. And what we don't want to see, and what I think the EMRAM model emphasizes, and my own practice and data analytics maturity emphasizes, that the people are the core to managing change. And they have to feel like they're in a place where their voice can be heard and that there's trust and empowerment to bring their concerns and improvement opportunities to the table. And it is the opposite side of that, where it's a highly centralized IT change management or data barriers, blocking access to the right data to understand and contextualize what's happening. It has to be a healthy balance that aligns well with your organization's culture, but it's certainly not one extreme or the other. And so I think when it comes to EMRAM, when we were talking about clinicians at the table, that is certainly one of the most important things. It is not improving your EMR is not something that can be done as a request. It has to be at the table with a collaborative attitude and really designing and empathizing with what's the current state and what are the limitations to achieving the desired outcome. And it's very much something that is it's a habit to learn. It's a new muscle to flex, and it really comes through practice. And that's why I envision anything having to do with better data and better decision support, leading to better advanced innovations and advanced analytics is an iteration. So quick wins followed by learning lessons, followed by more robust decision support tools requires very much a cross-functional collaboration. So, Christine, I don't know if you have anything to add to that.
And I would echo to that one too. Organizations that we see that are really adaptive in their EHR, they have a very top-down led initiative where this can come from the CEO level who encourages participation in different committees and governance structures. And we see when the CEO is very positive and the executive leadership is very positive about having the voices of the frontline workers, whether that's a unit clerk, maybe it's an MA, those roles that we sometimes don't listen to. When they are given the power of voice, those are the organizations that are able to move and bend and be very flexible as new data comes out, as new information is being released, as a nurse who goes to a conference and finds some really great information and wants to bring it back and see if it could be incorporated into, future clinical decision support tools and documentation. When the organization has that confidence within from the top level down to where any employee can come up with an idea and join a committee and be a part of that governance structure, those are the organizations we see that are able to amend their EHR to work for their clinicians and not just be a burden, not just a documentation system and not just something that they have to do during their day, but it becomes a tool for them and a resource that they can really rely on.
Great. Yeah, that's a really good point. Okay, I don't see any more questions in the Q&A, so just one last chance if there's any last minute questions. Okay, well, I'm going to close this out and say thank you so much for, again, spending part of your valuable time with us today. You will be given these slides and a recording after this, and there's also a white paper that I recently wrote that's going to be published alongside this, so you'll gain access to that. Please jot down our email addresses, be in touch, continue the great work you're doing, and we are two organizations very passionate about supporting that in any way we can. So thank you to Christina, and I've really enjoyed this time together.
Yes, thank you all. Have a wonderful day.